In-hospital resuscitation. This can be a tricky station in your OSCE. There might be a lot of errors which you want to know, how do I fix them? It might be head till chin lift I'm not doing properly. My hand position in the chest compression on the dummy might be too high or too low. The depth, how do I get it right? The rate, I get 140, 150 or less than 100. How do I get it right between 100 to 120? Cardiac arrest call, I forgot completely put it, or when I'm putting the call, I did not put it right. Let's look at all these errors and fix them so that these can help you in your actual OSCE. Now please do not forget to subscribe our YouTube channel HST Learning. This is Gilbert Martis from Health Skills Training coming to you. We love to hear your comments. Hit the like button. Anything you want to see more, let us know in the comments below. We will put that for you. Let's look at the common errors that you see in in-hospital resuscitation. Number one common error people look for is, do I get a scenario in this station? Is the examiner going to tell me what type of patient am I going to get? Simple thing is, you have a dummy there and you know that it's a resuscitation station. Whether you have a scenario or not, whether you know the patient name or not, it is an emergency situation. You need to ensure the area is safe to enter. Sometime if the examiner says there is water on the floor, you need to make sure it is safe for you and to the patient. You might need to move the patient out of the water and dry the patient and continue. So just make sure if the examiner says there is water on the floor, assessor, I'm going to make sure, okay, I am going to move the patient, I'm not going to trip. So these are the little things you need to look for. First, you need to verbalize loudly, I'm going to look for the danger. Once you looked and confirmed the danger, you're going to check for response. Say it loudly, I'm going to check for the response. What some people do is, because in the actual cardiac arrest situation, you need to be very quick and you should be acting very fast as well. But here, this is an exam. Your examiner will be sitting there observing you and watching you what you do at every stage. Now, for me, more important here as a candidate, I need to verbalize, I need to slow down a little bit and verbalize everything I do in this station. So, such as assessor, I'm checking for the response. So shake and put the arm on the shoulder. Try not to hit the dummy so you don't know whether the patient is unresponsive yet. Some people come here and hit the dummy like this. If the patient is alcoholic and drowsy, it might be you see patient giving you a punch. So that's why I try not to hit the dummy. So put the arm on the shoulder and shake the dummy. Can you hear me? Can you hear me? If required, you can give a trapeze pinch, put a finger on there and with the thumb press or squeeze the trapeze muscle. These are the muscles you can squeeze. If you don't know how to do it, ignore it. You don't require to do this in this particular station for your test. So you check for the response. Hello, can you hear me? Can you hear me? Confirm that there is no response and you need to shout out for help. This is another common error people forget. The moment there is no response, say help, help. And emergency buzzer you need to put out. It can be pull on the wall or press. Always test it before you start this station so you can pull or push. It will make noise. Sometimes you might have a dummy one because it's an exam situation. So once you have done it, so do not wait and look for the helper to arrive. That won't happen in actual hospital situation. The moment you pull the buzzer, emergency buzzer, you will have about 10 to 15 people running and coming to help you. So that's why don't look for the helper to come and help you. So your examiner will be the helper in your exam. So Once you have pushed the emergency buzzer, next common error is people not verbalizing, assessing the airway. You have to assess the airway, then open the airway. What are you assessing for? You're assessing for any blockage. Usually can be secretion or anything blocked in the airway, might be a denture. If it is too deep in, you don't try to take it off. If there is secretion, you can just verbalize that, okay, examiner, I'm going to do the suction. Just verbalization is enough. Then head tilt, chin lift. You have to open the airway. Opening here, head tilt, you put the arm on the forehead and tilt the head back and lift the chin all the way. Common error here is people either not tilting the head all the way, so doing only little. So you got to do all the way, head tilt, chin lift, and keeping the head tilted. What happens at this moment? Your tongue comes forward and opens the airway. If you let it go for breathing assessment, some people doing the breathing assessment from here, assessor, I'm assessing for breathing. This is one of the common error where you are not able to hear or feel anything. So what I would suggest is do head tilt, chin lift all the way, and then keeping the head tilted, go very close to the patient and to the face, very close. Your chin has to be very close to the patient face. Feel for the warmthness, listen to the sound. Ear is very close as well, and look at the chest rise. You shouldn't be looking that way. You should be looking to the chest. Look for rise and fall of the chest. Feel for the warmthness and listen to the sound. How long do you need to listen? This is 10 seconds. Make sure you can count it 10 seconds. That's one of the another error people do not count it. Why is it 10 seconds important? If patient has, let's say, low respiratory rate, you might be missing one respiration which is coming out in maybe 7 to 8 seconds. So that's why it's important for you to count for 10 seconds. You can count it as 1, 2, 3, or you can count as 1001, 1002. So count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So once you are confirmed, verbalize that, okay, there is no signs of life. You look for signs of life, movements of hands, rise and fall of the chest. Can you feel anything? Can you hear any sound? So there is nothing you could hear. So at this stage, you confirm the cardiac arrest. You want to put the cardiac arrest call on. So your assessor will be the helper because it's a hospital situation. So you always have the helpers around you. Be clear in putting the cardiac arrest call. If you say crash call, sometimes people don't understand. Say, can you please put the cardiac arrest call? You can say 2222. Sometimes if you say 2222, people say only 3 twos. They miss the 4th two, or they might say 5 twos. So best to say, I always say 2222. Can you put the cardiac arrest call by ringing 2222? So you can say 2222 is very clear for them, all right? And confirm the location. Cardiac arrest at this location, it's an adult cardiac arrest. Can you please bring the emergency trolley? In the hospitals in UK, so they have an emergency trolley between wards, or sometime each ward has a red trolley. That red trolley is for resuscitation. All the equipments are there in that particular trolley. So you just need to mention, can you please bring the emergency trolley, which is a red trolley, and can you bring the ambu bag and oxygen? So even if you don't mention ambu bag and oxygen, if you say red trolley that has defibrillator, that has ambu bag, that has oxygen, that has fluids, it is divided into airway, breathing, circulation section in that particular trolley. So can you please put the cardiac arrest call for me by ringing 2222? Tell them it's an adult cardiac arrest. At this location, can you bring the emergency trolley for me on your way back?
Yes.
So slow down, make sure absolutely clear what you're saying and confirm it. Is it clear for you?
Yes.
Alright, so once the person is going, or S means so person is taking care, your next step will be starting with the compression. So you have done airway, you're done breathing, now you go straight for compression. When you come to the compression, again I would suggest slow down a little bit. This is exam, you need to explain everything. So my suggestion would be, first thing is hand position. Normally people go like this. If you go like that there and position there, that is too low. And if you go there, it is too high. So best thing to do, that's the axilla, mid-axillary line. For test situations, you can see, you can position your heel of the hand in between the nipples of the dummy. Please do not verbalize that. Naturally, it won't happen. Okay, so you need to say, I'm going to position the hand center of the chest, mid-axillary line. So mentally you know your hand, heel of the hand in between. I always say middle finger on top of the nipple. So that way my heel is center. So you're going to compress the chest while you are holding the heel of the hand there. Position yourself nicely, touch the bed and lock the hand if you need. Not necessary to lock the hand. Most important here is the depth compression. That is what you need to focus on, not locking. So hold it there nicely and put your body weight on. Make sure your arm is straight. Alright, don't bend it. Arm is straight and make sure put the body weight on the dummy. Can you see it? I'm leaning over and my nose is pointing in front and I have already compressed about 2 to 3 centimeter before even I started the compression. How's that happened? Because I am using my upper body weight. Head is normally heavy, so it's leaning forward, so I don't get too much tired when I do the compression. I use my upper body weight. Now, so when you start the compression, say it loudly. Assessor, I'm going to compress 5 to 6 centimeter deep at the rate of 100 to 120 starting now. So compress hard and deep and count the rhythm. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So now here is important is how do you keep up with the rhythm? So when you're starting, position is very clear. So lean forward, compress hard, keeping the hand straight, lean forward and count. 1, 2, 3, 4, 5, 6. You can say the song, Staying Alive. So that's the same rhythm it gives you so that your compression is 100 to 120. So you can use the clock to clock yourself. Your compression has to be in between 100 to 120, so you can, time yourself for 15 seconds. In 15 seconds, your rhythm will be 25 to 30, but you always stop at the 30 compression. So my hand position, center of the chest, in between the nipples, if you can see there, but don't verbalize in between the nipples as I said. Hand position there. And I'm going to compress the chest 5 to 6 centimeter deep at the rate of 100 to 120 starting now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So go hard and deep. What happens naturally in a training situation or simulation exam situation? This dummy is connected to the monitor. So little sensor is there inside here that is connected to the monitor on the computer. The moment you start compressing 2, 3, 4. It senses the depth. Automatically it multiplies how much is the rhythm you're picking, or what's the rhythm you're picking, what's the depth. It's normally 5 to 6 centimeter. Anything below the 5 centimeter, it will give the red signal. If you get the red signal, that means you're not going deep. So don't look at the computer so you can't see it. This is normally for the assessors to see it. Your focus has to be go deep and hard. Ideally, 90% of people do not meet the depth of 5 centimeter. So go hard and deep. 1, 2, 3, 4, 5, 6. So go hard and deep, and then make sure you count the rhythm. Counting helps you to stay in the rhythm. 1, 2, 3, 4. So once you're done the 30 compression, then ambu bag will be ready in your exam. So examiner will put the mask on. So let's see how we put the mask on. Now common error here is candidates not identifying the mask, how it's been put on. So I'll show you an error here. So can I just have that for a second?
Yes.
So you might be putting, or the examiner might be holding the mask this way, and 2 down on the chin. All right, so that is not a good seal. So let me show you the mask here. It's a triangle. Can you see the triangle? Yes. This is the nose end. That needs to go to the nose. That is the chin end. Let me show you clearly here. So if you put it that way here, and now you can see how it's positioned. So if you look at in line with the chin there, and it's sealing the nose is a perfect size. It's not too small or too big. You don't need to worry about the size here. Normally they have the right size, but make sure it is sealing properly. So put it nicely. Is a triangle end, and sometime if they hold it that way, it is your responsibility to make sure mask is right way around. Once the mask is right way around, how do you hold it? People struggle holding the mask, but in the exam situation, your assessor might be holding it for you. Make sure you hold it like C and C on top, and another finger C cup on top. Press it nicely and tilt the head back. Tilting is very critical, otherwise you won't be able to give the ventilation. The ventilation might go to the tummy, which is to the abdomen. So make sure tilt the head back nicely. So ambu bag will be connected. If it falls off, don't worry, just pick it up and then connect it nicely here, because exam situation under pressure, ambu bag might come off. Just pick it up and connect it and seal it nicely. Can I please have you to hold there? Okay, and can you tilt the head back for me, please? So now it's nicely held and it's sealed properly. So my responsibility here, common error is forgetting to verbalize connecting the oxygen. What's the level of oxygen I need to be verbalizing? It's always 100%. What's 100% on flow meter? It's 15 liters. Flow meter, that small balloon, has to be all the way on the top, right? So 15 liters, verbalize. If there is a flow meter, connect it. Do not pretend that, okay, it's connected. Just put it on, and for the exam situation, you just verbalize that, okay, I'm going to put it on 15 liters of oxygen, which is 100%. And I'm going to give 2 ventilation, 1 over each second. How do you give ventilation? Now, some people do ventilation like this. What's going to happen here? So what happened there? Now I squeeze the whole bag, and this bag is about 1.5 to 2 liters. Do I need 1.5 liter here? You need only 500 ml. All right, that's the capacity you need for the lungs. Now compressing method. So how do you give ventilation? It's best way to compress. You can put the hand there like that with the grip, and you can use one hand, 1, 2, or you can 2 hands. Have a look. I only press the thumbs there, hold it rounded, and press half of the bag. Try not to press the whole bag, that is too much, and go like as you breathe normally. Don't go faster like this. 1, 2. So you should be going 1, 2. So when you're giving ventilation, just make sure you have the chest rise and fall. If not, you have not got the good seal there. Can you see it is having a chest rise? That means you're giving good 2 ventilation. If it is unsuccessful, first one, try again. Don't waste the time too long, because chest compression is critical to continue. So you're given the 1 cycle of chest compression. You've given 2 ventilation. 1, 2. So continue chest compression. Hand position second time has to be exactly same place where you had first time. In case you compress too low, see how soft it is. It should tell you that you're not compressing proper. If it is go higher here, see harder, very hard there to compress. It has to be center of the chest. Another common error people do here is your heel of the hand on the ribs or here. Heel of the hand has to be center, which is the strongest part of your chest. So you compress the sternum, not the ribs. So don't compress the ribs. Make sure you have the heel of the hand central and go harder. Okay, that's the common error you can see in terms of rate, rhythm, and giving the ventilation. Now, you need to carry on compression. That is fine. Thank you. Right? So you need to compress the chest for until 2 minutes. Ideally, this will take about 4 cycles. Now in test situation, if you're done absolutely very good compression, first one going nice, and you're given 2 ventilation, continued, your assessor might ask you to stop because they see that, okay, your compression rate and rhythm is absolutely very good. Now your compression rate and depth is not right. Sometime they might ask you, can you go harder? Sometime might be they go quiet. They might not say anything, but your focus has to be perfect compression and the depth. Now you've done the 2 cycles or 3 cycles. Do not stop unless you've done 3 cycles and you're giving ventilation, you're tired. You need to verbalize, okay, I am tired, can you please take over for me? Don't expect them to stop or stop after 2 cycles. Ideally, you should be compressing the chest for 2 minutes, which is 4 cycles, unless and until you are tired. Say, assessor, I am tired, can you please take over for me? So then they will ask you, stop there, Gilbert, or stop there, candidate. All right, what would you do next? Next question, or the normal question you would get is, what would you do next? The answer for this would be simple, important, critical. People forget here. You need to verbalize, examiner or assessor, I'm going to continue the compression. I am going to give the handover using S bar. They might not ask you to give a handover. They might say, that's fine, you can stop there. They might wait for you to say S bar handover. They might ask you directly, can you give the S bar handover for me? Situation, background, assessment, recommendation. This is cardiac arrest situation. Keep it simple when you are giving the handover. Situation was, I have a person admitted, his name is John, with chest infection and high temperature. Background is, he is admitted with a chest infection, but he is known to have hypertension. Assessment is, I did confirm the cardiac arrest and I did 3 cycles of chest compression with ventilation. Recommendation is, I want you to take over. Because the research team, they should be taking over the compression as fast as possible and need to act swiftly to give the defibrillation. This is how you identify your common errors and rectify them for your OSCE. Hope this video has made sense to you, so it helped you to identify common errors that might come across. And people ask me one more question always: do I need to check the pulse? Now if you look at resus guidelines, European resuscitation guidelines, UK guidelines, now have a look at, there is no mention of pulse checking. So what happens if you go to check the carotid pulse, many a times nurses might not be able to feel the pulse. You might be wasting about 10 seconds of your valuable time. So instead of checking the carotid pulse, you will need to look for signs of life, go closer to assess the breathing and signs of life. So that itself is enough to confirm the cardiac arrest for you. Unless there is signs of life, then you will need to check the carotid pulse. For this particular situation, for resuscitation, in hospital resuscitation, you do not require to check the carotid pulse. Another common error people always do when it comes to chest compression, because you are anxious, you put the hand in there without position and you go 1, 2, 3, 4, 5, 6, 7, 8. Now you automatically saw me here, I'm going fast. Other thing you can do is going slow, 2, 3, 4, 5. So you need to make sure your rhythm is perfect and your depth is about 5 centimeter, 5 to 6 centimeter. It's about bridge of the nose to the tip of the nose. So this much is about 5 centimeter, if you know what's a 5 centimeter look like. So you can see here, so you need to go harder. So don't worry about exact 5 centimeter, but computer will pick it up, but your focus should be going hard and rhythm should be 100 to 120 count. 1, 2, 3, 4, 5, 6, 7, 8. So that's rhythm all the way, and keep it on with the rhythm until 30, and then make sure you give the oxygen. Hope this video has helped you to understand, fix the errors that you have in your in-hospital resuscitations. This is a practical skill. You need hands-on practice. You need to practice with the mentor so that they can put you right. So contact Health Skills Training for your OSCE preparation. We are here to help you. Thank you.